Okay, let's discuss the 5 transporting points, Jingwell points, GB44, the foot portal yin. Location on the fourth toe, point 1 tune from the lateral corner of the nail. How to find GB44 is located at the junction of 2 tangents along the proximal and lateral borders of the fourth toe. Bladder 67 is located on the lateral corner of the little toe. Needling 0.1 tune vertically or 0.2 tune obliquely in a proximal direction or prick to bleed. Caution, painful point. For the action indication, GB44 clears wind, heat, and fire, harmonizes the liver and gallbladder, calms the shen. Special features, GB44 is a Jingwell point, metal point. GB44 is used for migraine headaches around the eyes from rising of the liver yang. It has an influence on the eyes and is used for red and painful eyes from the flaring of liver fire. It also calms the shen in cases of insomnia and agitation derived from liver fire. Subdues liver yang, those having headache, dizziness, blurred vision, stabbing pain in the head. It also clears heat, brightens the eyes, those having pain in the outer canthus, redness, swelling, and pain in the eyes. It also calms the mind, those having insomnia, nightmares, somnolence, agitation, and anxiety. The name GB44, the importance of the foot, is said to refer to its ability to treat diseases of the sense organ associated with the 5 sound, namely the eyes, liver, ears, kidneys, tongue, heart, mouth, spleen, and nose, lungs. In fact, classical indication appears for all these except the nose. In this respect, GB44 on the lower body mirrors GB11 portals of the head in the upper body. GB44 is the Jingwell point and therefore most distal point of the gallbladder channel. According to the spiritual pivot, the disease of the head selects the points from the feet. GB44 has long been cited by numerous classical sources for disorders due to gallbladder fire rising to disturb the head or exterior wind heat attacking the head, giving rise to symptoms such as headache, headache with agitation, sudden deafness, tinnitus, dizziness, swollen red, and painful eyes, and throat painful obstruction. As the terminal and therefore most dynamic point of the channel, GB44 is especially indicated when these conditions are severe and acute. The classic of difficulty states that Jingwell points treat fullness below the heart, while the region below the heart specifically refers to the apex of the epigastrium. Like many of the Jingwell points, GB44 treats stagnation and fullness throughout the chest region. When liver chi stagnates in the chest, the lateral costal region, there can be distension and pain. GB44 is the metal point of the gallbladder channel and is used was emphasized in classics such as the systematic classic of acupuncture and moxibustion and the great compendium of acupuncture and moxibustion for pain of the lateral costal region with cough and inability to catch breath. The symptoms occurred when liver chi or liver fire invaded the lung, wood insults metal. The gallbladder divergent channel links with the heart, and wood is the mother of fire. The gallbladder fire, therefore, may easily transmit to the heart and disrupt the spirit, disease of the mother affecting the child. In common with many of the Jingwell points, GB44 is effective to calm the spirit like other Jingwell points of the feet. Example, stomach 45 and spleen 1 to treat disorders of sleep such as insomnia and nightmares. In discussing GB44, the investigation into points along the channel said the gallbladder heat, somnolence reduce it. For gallbladder cold, insomnia reinforce it. Finally, unlike the majority of the jingle points of the 12 channels, GB44 does not appear to be indicated in the major classics for restoring consciousness. The metal point of the gallbladder meridian will bring quality and inspiration to gallbladder qualities, growth, and decision and judgment. The alternative name for this point, foot portal yin, reminds one of the qualities shared with GB11, but treat the portals of the sense organ, eyes, mouth, ears, nose, and tongue, and the five sung. Here, at the most distal yin point of the gallbladder, one is returned to the other extreme of its heavenly reaches, the senses, all of which are crucial to the ability of the gallbladder to carry out its responsibilities, and all of which are nourished by the pure vitality of the gallbladder imparts. The restraint, the pulling back to the inside, to the yin that is the nature of metal, can counter the impulsive yang nature of gallbladder when it is insufficiently rooted. The tip P governs our natural rhythm and instinctive responses. The gallbladder is out of balance movement. Speech, thought, pattern can become very disjointed, uncoordinated, and abrupt. Decisions can be made so quickly that they may not be backed up with reflection or with the wisdom of experience and sense of balance that metal can garner from life. This point can help restore equilibrium and rhythm, orderliness to the gallbladder. This point is used for migraine around the eyes from the liver yang rising. It has an influence on the eyes as the distal point of the meridian and is used for red and painful eyes from liver fire. When liver fire disturbs the shen, causing agitation and insomnia, and dream disturbs sleep, this point can help calm the shen. As the jingle point, it can clear heat and relieve fullness beneath the heart, obstruction along the pathway, and hypochondriac lateral costal pain. Also, as the metal point on the gallbladder meridian, when there is stagnation of qi in the chest with coughing or feeling unable to catch the breath, this point can be used to clear cough and facilitate the passage of qi. Used to relieve stagnation or pain caused by stuck qi in the muscles, joints, tendons, or by pent-up anger and frustrations. Used for inflammation of the dorsum of the foot. Subdues liver yang, benefits the eyes, calms the mind, benefits the head, clears it. Thank you for your attention.
Now let's talk about the 5 command points. We start with stomach 36, leg 3 miles. The 5 command points are those points that have the strongest and most general influence on a specific area. The 5 command points are stomach 36 for the abdomen, bladder 40 for the back, lung 7 for the head, LI4 for the face, pericardium 6 for the chest. Stomach 36 is located 3 tsun distal to stomach 35, or the lateral eye of the knee, and 1 finger breadth lateral to the anterior crest of the tibia on the tibialis anterior muscle. How to find stomach 36? First, locate stomach 35, the lateral eye of the knee, at the level of the knee joint space. From stomach 35, palpate 3 tsun, or 1 hand breadth down, and 1 finger breadth towards lateral by placing the middle finger adjacent to the tibial crest. There, stomach 36 is located in a depression, which can be palpated dynamically. Choose the point according to pressure sensitivity, or palpate the lower border of the tibial tuberosity and dynamically locate stomach 36, 1 finger breadth lateral to it. Needling of stomach 36 vertically 1 to 1.5 tsun, moxa is often used. Actions or indications: regulates the stomach, strengthens spleen, transforms dampness. tonifies qi and yang, nourishes blood and yin, calms the shen, opens the channel. Special features of stomach 36, Husi point, earth point, pen point, or the five faces point, lower Husi point of the stomach, Kao Wu command point for disorders of the abdomen, Madan Yang point, sea of water, and grain point. The main point to tonify qi and blood for general weakness. Very important point. Stomach 36 is a major and important point, a great strengthening and enriching point for body, mind, and spirit. It feeds one's earth element and underpins all the responsibilities of the stomach official. Moksha on this point was said to allow people to march 3 li, a measure of distance, further, and thus it promotes stamina. Wei defensive qi is nourished in the middle jiao. Stomach 36 can be used for prevention of attacks from exterior forces. Moksha mentions it was often traditionally used with moksha. Machocha mentions it was often traditionally used with moksha every 5 to 7 days for 10 minutes on people over 30 as a preventative treatment to keep free from disease and strengthen upright qi. Stomach 36 is a great point for general improvement of health, strength, and resistance to diseases at any age. It is specific for treating chronic emotional lability due to illness, weak constitution, overwork, or old age, used after debilitating or chronic illnesses. As it tonifies upright qi, it also strengthens resistance to attack from exterior pathogenic factors, raises the qi, and used with moksha, it raises yang, and so can be used for prolapses. As a Husi point, it can reverse counterflow qi. It regulates and harmonizes stomach qi, strengthening digestion, improving appetite, relieving indigestion, treating weight loss, and strengthening weak muscles, relieving epigastric pain. Known as the command point of the stomach, its strong qi coursing properties relieves pain, distension, and masses in the abdomen. Being the earth point on an earth meridian enhances its earth qualities. Earth gives one form and a place on which and in which to live one's life. Earth within earth has a harmonizing action, steadying and facilitating nourishment and resilience. The rotting and ripening performed by the stomach official, the maceration of thoughts, ideas, and food is central to qi production. The 5 yin organs all derive qi from the stomach. Thus, the stomach is the root of the 5 yin organs. Without this crucial role carried out by the stomach, a person will feel weak, unable to stand their ground, unable to give form to any of their thoughts, and perhaps unable to think clearly. When the stomach is deficient, the person can feel disorientated and agitated, worried, not at home, or at ease in themselves. This point can calm and strengthen the mind and spirit. Used as a horary point in its time and or season, can access the full benefit of this point. As stated in the commentary on stomach 30, stomach 36, and 30, together form the sea of nourishment. They are called upon when there is long-term severe malnutrition and depletion of the stomach and spleen or digestive stagnation. The great reservoir or sea of nourishment and the strong coursing action of both points can help bring relief. Tonifies qi and blood, being a Husi point, gives it the property of releasing qi and blood that is abundant in the yang ming. This Husi property of clearing stagnation can free the entire body, whether from emotional depression, excess worrying or studying, or physical problems. Stomach 36 benefits stomach and spleen and is used in all cases of the stomach deficiency of stomach and spleen to improve rotting and rightening of the stomach and transforming and transporting function of stomach and spleen, and thereby tonifies qi of the entire body and helps disperse damp. The alternative name of ghost evil indicates its use in epilepsy, manic depression, schizophrenia, depression, or when heat in the yangming is causing wild behavior. This point both calms the mind and strengthens the body. Stomach 36 harmonizes yin nutritive and wei defensive qi so that the yin nutritive qi stops sweating and the wei defensive qi expels pathogenic factors. Used in cases of edema when defensive qi is weak in the skin layers and fluids overflow from the channels to invade the space under the skin. Tonifies blood, tonifies lung qi. Regulates intestines, especially where there is constipation from deficiency and stagnation. Regulates blood pressure, brightens the eyes, can be used for blurred vision and declining eyesight in old age. Expels wind and damp from the channels where there is obstruction and pain. Local point for knee problems. The abundant qi and blood from the yangming, released by this point, nourishes the sinews and makes it useful in paralysis of the lower limbs. And finally, stomach 36 promotes lactation. From the breast connection with the stomach meridian, this point can free stagnation in masses and pain. Thank you for your attention.
We continue with the Lu connecting point, REN15, turtle dovetail. Location on the anterior midline, 1 June inferior to the sternocostal angle, or 7 June superior to the umbilicus. How to find? The distance between the sternocostal angle and the center of the umbilicus is divided into 8 June, which can vary considerably from the patient's finger tune. Therefore, only proportion tune measurement should be applied here. Helpful device, elastic tape. From the sternocostal angle, measure 1 June in an inferior direction and there locate REN15 on the anterior midline. It is often located directly below or depending on individual anatomy on the sepoid process. Needling 0.5 to 1 June obliquely in an inferior direction. The patient should be in an extended position. Caution, possible injury to organs with deep needling or oblique insertion in a superior direction, especially in patients with hypertrophied organs. Left liver, right heart. According to some classic texts, maxibustion is contraindicated. For the action indication, regulates the heart, calms the shen, descends counterflow, lung, and stomach qi, unbinds the chest, regulates the Lu connecting vessel of the renmai. Special features, Lu connecting point of the renmai. Important point for calming. The name arises from the anatomy of the chest, the sternum being said to resemble the back of a turtle dove. The ribs, its feathers, and the sepoid process, its tail. Dovetail treats at the level of the spirit, particularly for the heart protector. The role of the heart protector is to screen the heart from direct attack, but this can impact the heart protector itself, leading to feeling emotionally bruised and vulnerable, wearied, and fragile. The heart protector and renmai both play a part in protecting the heart. REN15 steadies and regulates the qi. Dovetails connection with renmai and the blood and the circulation of blood in yin. Its role as the source point of the original qi of the 5 yin organs make it usually sustaining resource for heart protector at this level. The connection with the yin and blood will succor the heart protector and ground it, imparting strength and encouraging appropriate opening and closing when relating. If we are secure in ourselves, we can be more expansive. This nourishing aspect of the renmai and its association with taking responsibility encourages the maturity of fire. When the heart protector has retired hurt and become defensive, then REN-MI can help it recover and realign its consciousness and higher purpose, knowing that it can endure and retain the sincerity and compassion appropriate to fire and its role as the heart's protector. Benefits the original chi through being the source point of all the yin organs, so it nourishes the yin and helps, and this help calms the mind and spirit, particularly where this arises from deficiency of yin. Regulates the heart, helps to clear stagnation when there are feelings of oppression and sad resignation from stagnation of chi and blood, expands and relaxes the chest and calms the spirit. Dovetail is the front move point of the heart protector. Front move point becomes spontaneously tender when their associated organ is imbalanced. Because of this spontaneous reaction, some consider them mostly for acute situation, but move means to collect, raise, enlist. And the chi of the associated sampu collects and concentrates at these points. Front move points are yin in nature and can be used in non-acute situations to nourish and strengthen the particular sampu, but without a direct effect on the particular meridian. They can also be combined with back shu point of the same associated sampu for a particularly reinforcing and strengthening treatment. The loop connecting channel of REN-MI leaves REN channel at the inferior border of the sternum at REN15 and spreads over the abdomen. Transforms phlegm in the heart so can be used when there is hysteria, mania, and intolerance of noise. Clears heat, benefits the diaphragm, and redirects rebellious chi downwards. REN15 is similar to effect to REN14 as it protects and supports both the supreme controller and heart protector. Can be a helpful point for panic attacks, particularly when loved ones are involved, and for aiding drug withdrawal, including tobacco. Thank you for your attention.
Let's now talk about bladder 29 and bladder 30. These are both back shu points. Bladder 29 is located on 1.5 tune lateral to the posterior midline on the level of the third sacral foramen. How to find bladder 29? First, we can palpate for the lumbar and sacral region. First, we have to find the lumbar 5. The next palpable structure in an inferior direction is the most superior sacral spinous process. Palpate in an inferior direction for 2 further sacral processes and locate the third sacral foramen in a depression less than 1 tune lateral to the third process. Bladder 29 is located on the same level, third sacral foramen, and 1.5 tune lateral to the midline. Also located on this level is bladder 33 over the third sacral foramen. Needling vertically 0.5 to 1.5 tune. Actions, indications, strengthens the lower back and the kidneys, expels cold, regulates lower burner, and stops diarrhea. This is called the middle of the backbone correspondence and is indicated for pain in the back and spine, particularly when there is pain and stiffness in the muscles on both sides of the spine. Benefits the low back, dispels wind and cold, warms yang, circulates the chi. This is for spinal or sacral pain and stiffness, especially if the pain is on both sides of the spine. Bladder 30. Location, 1.5 tune lateral to the posterior midline on the level of the fourth sacral foramen. First, find lumbar 5. The next palpable structure in an inferior direction is the most superior sacral spinous process. Palpate in an inferior direction for 3 further sacral processes and locate the fourth sacral foramen in a depression less than 1 zoon lateral to the fourth process. Bladder 30 is located on the level of the fourth foramen, 1.5 zoon lateral to the midline. Located on the same level are bladder 34 over the fourth sacral foramen and bladder 54, 3 zoon lateral to the midline. Needling of bladder 30, vertically 0.5 to 1.5 zoom. Actions, indications, strengthens the lower back and the knees, eliminates damp heat from the lower burner, regulates menstruation. Bladder 30 has an effect on the anus and is mostly used for anal problems such as hemorrhoids, prolapse of anus, spasm of anus, and incontinence of feces. White ring, in its name, refers to the anus. Bladder 30 benefits the anus, so this is very good for itchy anus, prolapse of anus, anorectum, hemorrhoids, difficult defecation. Strengthens the lower back and legs, pain in the lower back and sacrum, regulates menstruation, irregular periods, painful periods, heavy periods, firms chi, seminal emissions, and leukorrhea. Bladder 30 is primarily used as a local point to activate circulation of chi and treat pain of the lumbar region and sacrum, pain of the lumbar region and hip, and especially pain of the coccyx. In common with many points located on the sacrum, bladder 30 is also able to regulate function of uterus and genitourinary system. It is specifically indicated for stopping leakage in the form of seminal emission and nocturnal emission, leukorrhea, and white turbid urine. Bladder 30 is mostly used for its local effects within the whole lower abdominal and sacral area. It has an effect on the anus, uterus, genital area, and sacrum. Regulates menstruation and the uterus. Local point for the low back. Ellis, Weisman, and Boss explained that white ring in Taoist metaphysics refers to the area of the body where essence is stored and through which the bladder meridian passes via this point and which also connects with the anus. So it affects the anus, uterus, genital area, and sacrum. For painful defecation, hemorrhoids, lower back, pain on it, or irregular menstruation. Thank you for your attention.
We continue with the large intestine channel, Sinew channel. Pathway, the large intestine Sinew channel begins on the index finger at LI1, runs along the index finger and the second metacarpal bone towards the wrist where it binds at LI5, travels along the posterolateral aspect of the forearm, reaches the elbow and binds at LI11, continues along the lateral aspect of the upper arm and the deltoid muscle to the shoulder where it binds again at LI15. From LI15, a branch spreads across the scapula, then attaches to the spine between the 7th cervical vertebra and the 5th thoracic vertebra, or between DU14 and DU11. The main branch ascends from LI15, crosses the supraclavicular fossa, and continues from there along the lateral aspect of the neck towards the angle of the jaw where it binds. Here it forks into two branches. One branch runs across the zygomatic bone towards the lateral side of the nose. The other branch ascends the lateral aspect of the face and anterior to the small intestine sinuous channel, connects at GB13 with the other Sinew-Yang channels, crosses over the head and ends at the lower jaw on the opposite side. Note, according to some schools of thought, the Sinew channels only ends at LI17. Clinical importance, pathology. cramps, pain, tension, stiffness along the large intestine sinew channel, limited range of motion of the upper limbs and shoulders, occipital pain, stiffness, and limited range of motion. Indication mainly for B syndrome, painful obstruction syndrome along the large intestine channel. The area covered by the large intestine sinew channel is larger than that covered by the large intestine primary channel. This explains why the indication of points of the large intestine primary channel include disorders and diseases of the upper neck, thoracic region, as well as of the whole face, for example, frontal and temporal headaches. The large intestine sinew channel begins at the tip of the index finger at Xiaoyang, Li1, and binds at the dorsum of the wrist, ascends at the forearm, and binds at the lateral aspect of the elbow, ascends the upper arm to bind at the shoulder. A branch winds around the scapula and attaches to the upper thoracic spine. From the shoulder, the main channel ascends to the neck, from where a branch ascends across the cheeks to bind the side of the nose, while the main channel ascends to the anterior to the small intestine sinew channel, crosses the temple to the corner of the forehead, and crosses over the top of the head to connect with the mandible of the opposite side. Pathological symptoms of the large intestine sinew channel: cramping and pain along the course of the channel, inability to raise the shoulder, inability to turn the neck to the left or to the right. So we have here the large intestine sinuous channel crosses over the top of the head to connect with the opposite mandible, binds at the side of the nose. It attaches to the upper thoracic spine. So this one begins at the tip of the index finger at the Li1. Thank you for your attention.
Now let's talk about anatomical orientation. We are going to discuss the head, particularly the vertex, forehead, supraorbital region. Let's start with the vertex at ZU20. This is located at the junction of the cranial midline and an imaginary line connecting the apices of the ears. This point is at a distance of 5 sun from the anterior hairline and 7 sun from the posterior hairline, marking the highest point of the cranium or vertex. When locating ZU20, the patient's head should be in an upright position. Okay, let's now use the spreading hands technique after Koenig and Vankura. Chapter 2. Place the hands on the lateral aspects of the patient's head with the little fingers touching the apices of the ears. The thumbs are then joined at the cranial midline and will be pointing to ZU20. So here is the illustration of the location of the ZU20 and how to locate it easily. Now let's talk about the anterior hairline. The anterior hairline forms the superior border of the forehead and can vary considerably from person to person. The original line of hair growth is generally considered as the anterior hairline. In men, especially, the hairline may begin to recede early in life due to progressive baldness, so that the existing hairline may not be identical with the original line, which will now be located in an area not covered by hair. In these cases, ask the patient to frown. The original hairline will be located superior to the wrinkled forehead at the junction of the still slightly creased skin with the completely smooth skin. Points in this area are ZU20 to ZU24, bladder 3 to bladder 7, gallbladder 4 to gallbladder 7, gallbladder 13 to gallbladder 15, stomach 8. So here is the figure emphasizing the forehead, and the points located on the anterior hairline. Temporalis muscle and temporal corner of the forehead. By asking the patient to firmly clench and release his teeth, the temporalis muscle can be palpated on the lateral aspect of the forehead. The corner between the forehead and the temples is marked by the junction of the anterior hairline with the temporal hairline, which tends to become more pronounced with a receding hairline. Stomach 8 is located in the center of this area at the insertion point of the temporalis muscle and 0.5 tune within the natural hairline. Often, the coronal suture can be palpated here. Okay, so here are the figures emphasizing the location of stomach 8. Okay, another very simple illustration of stomach 8. Now let's go to forehead. The more or less prominent bulge of the frontal eminences can be palpated on both sides of the forehead. Gall bladder 14 is located at their lower border in a shallow depression at the junction of the eminences and the superciliary arches. With the patient looking straight ahead, GB14 is located directly above the pupil, approximately 1 tune superior to the supraorbital margin. Okay, so here is the figure illustrating the location of gallbladder 14. Glabella, superciliary arches. The glabella is the central bony reference point on the forehead, forming a slightly convex level area superior to the root of the nose and between the superciliary arches. The extra point in tongue, extra head neck 3, is located at the center of the glabella. Several points are located along the superciliary arches from medial to lateral, subbladder 2, ZUQIAOYIN, the extra head neck 4, and triple burner 23. Please note, bladder 2 is located superior to the inner canthus of the eye in the area of the frontal, not the supraorbital incisure when this is present. Thank you for listening.
Now we discuss with the window of heaven points introduction. Although these points clearly form a group of category of points, they are actually not explicitly mentioned in the ancient text as a category of points. For example, modern Chinese acupuncture dictionaries have no entries for window of heaven points. However, chapter 21 of the spiritual axis clearly lists some of the window of heaven points as a group of points with common characteristics. This chapter says stomach 9 is located on the artery on the side of the neck. Stomach 9 pertains to the bright young channel of the foot stomach and is situated in front of the muscle on the side of the neck. The point LI18 is on the bright young channel of the hand. Large intestine is located behind the muscle of the side of the neck. Next to it, there is TB16 pertaining to the lesser young channel of the hand, the triple burner. Still next to it is bladder 10 of the greater young channel of the foot, the bladder. The channel or blood vessel below the axilla belongs to the greater yin of the hand, the lungs, and the point is called lung 3. The same chapter then lists the symptoms for which each of these points is used. For headache from rebellious young and fullness of the chest with breathlessness, use stomach 9. For sudden loss of voice, use LI18 and bleed the root of the tongue. For sudden deafness with excess G, blurred vision, and diminished hearing, use TB16. For sudden twitching, epilepsy, and dizziness with inability of the legs to support the body, use bladder 10. For sudden severe thirst, rebellious chi, liver, and lungs struggling against each other, and bleeding from mouth and nose, use lung 3. These are the 5 regions of windows of heaven. Thus, this chapter of the spiritual axis mentions only 5 windows of heaven points. Chapter 2 of the same book adds another 5 to make a total of 10 as follows. Stomach 9, LI 18, TB 16, bladder 10, lung 3, REN 22, SI 16, SI 17, or GB 9, DO 16, PC 1. Some doctors thought that SI 17 should in fact be GB 9. This would be more logical since each of the 6 young channels would then be represented. With the exception of lung 3 and PC1, all the points are on the neck, which confirms the nature of these points as gateways of chi between the head and the body. 7 out of these 10 points contain the word heaven in their name. The window of heaven points have certain common characteristics and actions. The main common action is that of regulating the ascending and descending of chi to and from the head. All the window of heaven points except 2, PC1 and lung 3 are situated on the neck, which is strategic crossroad of chi between the head and the torso. These points can therefore be used when there is an imbalance of chi between the head and the body with too much chi or too little chi on the head. Too much chi in the head is generally due to rebellious chi rushing upward, and these points are widely used to subdue rebellious chi from the head. Stomach 9 is probably the best example of this action. Most of the window of heaven points subdue rebellious chi from the head, which can manifest as lung chi, stomach chi, and liver chi especially. The following is a brief list of indication of the window of heaven points related to subduing rebellious chi. Stomach 9, rebellious lung chi, fullness of chest, restlessness, rebellious stomach chi, vomiting, rebellious liver chi, headache, dizziness. LI 18, rebellious lung chi, cough, wheezing. TB 16, rebellious liver chi, headache, dizziness. And bladder 10, rebellious liver chi, those having headache, dizziness. Lung 3, rebellious lung chi, those with cough, wheezing, breathlessness. REN 22, rebellious lung chi, those with cough, fullness of chest, breathlessness, rebellious stomach chi, vomiting. SI 16, rebellious liver chi, those with headache. SI 17, rebellious lung chi, those with cough, wheezing, breathlessness, rebellious stomach chi, vomiting. DO 16, rebellious lung chi, breathlessness, rebellious stomach chi, vomiting, rebellious liver chi, headache, dizziness, head wind. PC1, rebellious lung chi, cough, fullness of chest, breathlessness, rebellious liver chi, headache. By virtue of their capacity to subdue rebellious chi from the head, many of the window of heaven points have a mental, emotional effect, especially in anxiety, insomnia, and mental restlessness deriving from rushing upward of chi. For example, in liver yang rising, liver fire, heart fire, kidney empty heat, etc. As they regulate the ascending and descending of chi to and from the head, these points can also do the opposite, that is, promote the rising of clear yang to the head. The rising of clear yang to the head will brighten the sense orifices, ears, eyes, nose, mouth, and the mind's orifices. This can therefore be used to open the mind's orifices in people with slightly manic behavior, obsession, confused thinking, confusion about slight issues, etc. Window of heaven points. All bar 2 situated on the neck regulate the ascending and descending chi to and from the neck, used for imbalances of the chi between the head and the body, subdue rebellious chi from the head, calm the mind by subduing rebellious chi, They can also promote the rising of clear qi to the head. Thank you for your attention.
Let's discuss wind cold, the prevalence of wind and wind heat as patterns for common cold and influenza. Clinical manifestations of wind cold, prevalence of wind. Aversion to cold, shivering, fever, slight sweating, occipital headache, stiff neck, body aches, slight cough, runny nose with white discharge, sneezing. Tongue, no change in the initial stages. Pulse, floating slow. This is a classic pattern of the greater yang when there is prevalence of wind. It occurs when the body's qi is relatively weak and defensive qi and nutritive qi are not harmonized. The deficient nutritive qi fails to hold fluids in and causes slight sweating. Treatment principle: release exterior, expel wind cold, and harmonize nutritive and defensive qi. Points: lung 7, Li4, bladder 12 with cupping, stomach 36, gall bladder 20, 216, bladder 13, Li20, do 23, bladder 18. We use reducing method on all points, even method on stomach 36 and bladder 18. Lung 7, Li4, and bladder 12 with cupping are the three most important points to expel wind cold. Cupping on bladder 12 is extremely effective. In most cases, just these 3 points are sufficient to clear the condition. Other points may be selected according to symptoms and signs, and these have already been explained. Stomach 36 harmonizes nutritive and defensive qi. Bladder 18, some doctors use this to nourish nutritive qi and blood, and therefore harmonize nutritive and defensive qi. Now let's talk about wind heat. Clinical manifestations: aversion to cold, shivering, fever, slight sweating, runny nose with yellow discharge, headache, body aches, cough, sore throat, swollen tonsils, slight thirst, slightly dark urine. Tongue is slightly red on the sides and or front, pulse floating rapid. Treatment principle: release the exterior, expel wind heat, and restore the diffusing and descending of lung qi. Points: Li4, Li11, triple burner 5, bladder 12, with cupping, bladder 13, do 14, lung 11, GB20, 216. We use reducing method. Li4, Li11, and TB5 are the 3 main points to expel wind heat. Other points are selected according to symptoms and signs. Bladder 12 with cupping releases exterior, expels wind. Bladder 13 stimulates the dispersing and descending of lung qi and stops cough. Do 14 is selected if heat symptoms are pronounced. For example, high fever. It should be needled obliquely downwards, and one should preferably obtain a strong needling sensation propagating downwards. Lung 11 with bleeding method expels wind heat and soothes the throat, and is selected if the throat and tonsils are sore, swollen, and inflamed. Gallbladder 20 and 216 expel wind and are selected if the headache is severe. Thank you for listening.